What we're looking at here is the Surgery Navigator. The Surgery Navigator and other navigators like it, like the ADMET Navigator, are ways to advance through the activities in Epic that are relevant to what you're doing in a chronological or logical order so that you don't have to jump around between the activity tabs that you have up here at the top. You can just simply sort of work your way up from the top down to the bottom. Each of those links that you see here on the left, they take you to activities or places that you can find, always find directly in those activity tabs. So these don't represent new areas of Epic. They're simply areas that already exist that will be outlined or kind of laid out for you in a flow that's a little bit more relevant to you and the work that you do. So all of these features can be found by going to the activity tabs like we've already looked at. And these are just ways to get you to more filtered, more focused views of the information that you're interested in. All of the navigators that we're looking at today will begin with the best practice advisory. Best practice advisory is essentially just where Epic has identified what it believes to be a gap between the documentation and the best practice. In cases where the best practice hasn't been followed, you can follow this link here that will take you to the Manage Orders screen. You can enter those orders. If those have already been addressed or the best practice advisory isn't clinically significant given your assessment of the patient, then you can document that as well. Second link, Power of Attorney and Advanced Directives, just gives you the opportunity to look at what the patient currently has on file for both of those things. The patient summary is where the Surgery Navigator gets to be a little bit different than other navigators. You can see that the summary at the top gives you just that basic information about the patient, but then you have the treatment team that's listed below. The treatment team piece of this navigator allows you to do something called Secure Chat. Secure Chat's linked to these icons that you see here with the little call out box and the green plus sign, or in this case over here on the upper right hand side, Chat with All. And that just gives you the opportunity, we'll go ahead and click on that. And that gives you the opportunity to go to a secure chat window where you can type a message and get that to other members of the care team that are relevant to you at that point. So let's go ahead and click back into our patient and we'll continue with the navigator here. Your next link that you can follow in the navigator is your 36-hour results. Again, those are just the results that are of interest to you from just the last 36 hours, relevant to the surgery that you may be about to perform. You can click the details link over here, and that will call out to you just kind of a little pop-up box that can give you a little bit more detailed information about the values that you see in front of you. And again, you can, of course, always go to the results review activity at the top if you need to interact with even more detail than what you have here. The allergies piece of the navigator is self-explanatory in terms of the information that's contained therein. However, Mark as reviewed is something that Epic will ask you to interact with in these navigators. That essentially is just your way of saying that you've reviewed the allergies before other care that you're going to provide, and you'll mark that as reviewed so that Epic will record that you've done that, and then you won't get a hard stop later on that asks you to return to that and mark that as reviewed. Prior to Admit Meds works in a very similar way in terms of asking you to mark the fact and stamp the fact that you've reviewed the medications that they came into the hospital on. You will notice that there are a couple of different places in Epic that you can interact with medications, and some ways are a little bit more fluid and relevant than others. But in this case, this just allows you to look at what the patient came in on and make any changes or address any of those that are of interest to you before moving on with your patient's surgery. Once you're through that piece, same as your allergies, you can interact with that simply by saying that you've reviewed it and move on. Your history tab is also something that looks a little bit different in the surgical navigator as opposed to the other ones. And this allows you to see medical history in something that's a little bit more almost like an ROS form, where you have a series of yes no questions that you can answer or ask your patient and record the answer for. You'll notice up here too that you have the opportunity to add the pertinent negative piece. And that, of course, is where you can record a specific clinical condition or the absence of a specific clinical condition that's relevant to you, as opposed to simply saying that the patient does not have that. You can answer these, and you can go ahead with me and we can click on a few of them. Go ahead and click here on what you have over here with the little piece of paper icon. And you'll notice here that you get a kind of a different view here where you can work with a list, more of a list sort of layout for medical history and pertinent negatives. If that's an easier way to work through the list, you can certainly use that. If not, you have a more user-friendly interface here. We'll continue to scroll down. Surgical history functions in much the same way as the other piece of history that we looked at there up top. Now, family history is where things, again, will look a little different from what we did above. So you have kind of a maybe a little bit convoluted layout here in terms of family history, relationship as far as relationship to the patient over here on the left. And then your green plus icons allow you to work your way through the grid, and you can document what's there and what's not. Now, the green plus sign allows you to add a problem that you care about that is not in the default set. So in this case, Addison's disease wasn't there initially, but let's say we care, it's relevant for us to record that. So we've hit the green plus sign, we've added the Addison's disease that way, and then we've come and we've marked that in the appropriate box. You can click the piece of paper icon there with the corner folded down on it and dive in and add more detailed information about the family members that you're documenting there. You can also, of course, use the add family member so that you can add extended family if that's of interest to you or clinical significance. And then let's come over here to the upper right-hand corner again. And what you have here are 3 different ways that you can view family history information. Choose whichever one is of best function for you. The checkboxes is the one that you see here. If you click on list, you get something that's a little bit less grid-like and a little bit more like a flow sheet. If this is a better view for you, you can choose that. Pedigree is an interesting view that's new in the Epic 2019 upgrade, and even if you've used Epic before, you may not recognize this particular view. This allows you to see the family history in a graphic map format or flow format as opposed to the grid. And so some physicians, particularly physicians in areas like oncology, find this family history to be important and this to be a good way to look through it. You certainly don't have to use that method, but that's available to you as well. So we'll close that there. That's called pedigree. So as we're down here with family history, you've got those 3 views. We've made our selections. Again, covered that we can add problems not already in the default. Check boxes that correspond to conditions the patient has or pertinent negatives. Employment history, pretty self-explanatory. When you say copy to history, what you're able to do is sort of just cite that into the patient's history of occupation or work, if that's clinically relevant to your patient. Demographics, self-explanatory information there. Tobacco and alcohol history, again, pretty self-explanatory, oftentimes answered earlier in the visit. And after we review the history, we'll come down to the problem list piece. The problem list is something that we'll dive into, or I should say that adding a problem is something we'll dive into in a little bit different section here, or we've already done that at this point. You can interact with the problem list here in exactly the same way you would if you were interacting with it ahead of time. You can add problems here, remove them, resolve them, add overview items to them, and that sort of thing. When you get down to the section here with the next three links, we're starting to look at your notes at this point. And this is where you'll interact with your H&Ps and your pre-op notes. So we've already looked a little bit at the overview of how notes operate. This is where you can see notes that are already there, that are attached to this encounter. If you want to view notes through sort of the big activity tab, the big notes activity tab, you can do that from here by clicking on this. That brings you to the screen that we've looked at already. That gives you all of the, gives you more screen real estate dedicated to notes and different kinds of notes. If we don't need to go to a screen that has that depth of information in it, you can see the notes that are already written here, the addendums and the sign notes as well. When you come down here and you're looking at pre-op notes and H&P notes, you can start a note from here. So in this case, let's just start a note for pre-op. And what you get is the ability to have your note over here on the side, and you can keep the other information here in front of you. So what we're looking at right now on the center screen is our problem list, what's right above us here. And over here in the left or the right-hand column, we have the ability to work with a note. So we have a split screen here, and this lets you use your smart text, smart phrases, any templates that you've already built, and you can work through those over here on the right side. We'll go ahead and cancel this one for the moment. And we'll return to pre-op notes where we were when we started. I'm going to close this window shade over here just to give us a little more screen real estate back. This is where you'll see your H&P notes. And again, you can click to see all notes if you want to go to the tab and actually dive even deeper into the notes that are there. If that's not relevant to you, you can keep this abbreviated view that you have here in front of you. And then lastly, on the pre-op piece, we'll click on the Manage Orders. The Manage Orders is something that we've probably reviewed already again in terms of the big activity tab. That's where you are here. And we've also already looked at how you could add order sets, or we may have looked at how you can already add order sets. If we haven't, we'll go ahead and look at that now. We'll show you how to enter orders from both order sets and how to enter individual orders. When you're done with this piece here, and you've entered all of the orders and notes and you've taken care of those things, then you're essentially through the information that we have in the pre-op Navigator.